Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine.
PTSD patients have lower chances of surviving COVID. Researchers from UC San Francisco and the San Francisco VA healthcare system have found that veterans with PTSD had an 8% increased risk of death if they had COVID and a 9% increased risk of hospitalization compared with patients with the virus and without a psychiatric diagnosis, adjusting for age, sex, race, and co-occurring medical conditions. Those with psychosis were found to have a 58% increased risk of death and a 66% increased risk of hospitalization relative to those without psychiatric diagnosis. For those with bipolar disorder, the increased risk of death and hospitalization were 29% and 46% respectively, and for major depression, they were 13% and 21% respectively. People who consume more antioxidant flavonols may have slower memory decline, according to study. Flavonols are a type of flavonoid, a group of phytochemicals found in plant pigments known for its beneficial effects on health. People who eat or drink more foods with antioxidant flavonols, which are found in several fruits and vegetables, as well as tea and wine, may have a slower rate of memory decline, according to a study published in the online issue of Neurology. The study involved 961 people with an average age of 81 without dementia. They filled out a questionnaire each year on how often they ate certain foods. The people were divided into 5 equal groups based on the amount of flavonols they had in their diet. While the average amount of flavonol intake in US adults is about 16 to 20 mg per day, the study population had an average dietary intake of total flavonols of approx 10 mg per day. The lowest group had an intake of about 5 mg per day, and the highest group consumed an average of 15 mg per day, which is equivalent to about 1 cup of dark leafy greens. Pregnancy interval guidelines following miscarriage or abortion challenged in the new study. The WHO recommends waiting 6 months after miscarriage or abortion before becoming pregnant again to avoid complications in the next pregnancy, yet evidence for this is scarce. Now, Gizachu Tasima of the Curtin School of Population Health Australia and colleagues conducted a cohort study with a total of 49,058 births following miscarriage and 23,707 births following abortion in Norway between 2008 and 2016. They looked at 6 adverse outcomes, that is preterm birth, spontaneous preterm birth, small for gestational age, large for gestational age, preeclampsia, and gestational diabetes. However, a recent study suggests that, contrary to current advice, women could attempt pregnancy after a previous miscarriage or induced abortion without elevated perinatal risk, and reassures those who want to try again sooner than the guidelines recommend. Shingles found to be associated with a heightened risk for stroke or heart attack, according to a study. Shingles often causes a painful rash and can occur anywhere on the head or body. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. After a person has chickenpox, the virus stays in the body for the rest of their life. Years and even decades later, the virus may reactivate as shingles. A new study by investigators from Brigham and Women's Hospital demonstrated that shingles, also known as herpes zoster, is associated with an almost 30% higher long-term risk of a major cardiovascular event such as a stroke or heart attack. The results are published in the Journal of the American Heart Association.
That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.